Alberta reaching a critical point as the healthcare system in the province starts to buckle under an influx of patients. Alberta also reporting the first death of a COVID patient under the age of 20, an 18-year-old woman. Ottawa announcing help for Alberta, including sending in the Red Cross. The province setting new pandemic records as well. 1,040 COVID-19 patients now in hospital, including 230 in intensive care. Hospitals are closing in on the 90% threshold of their surge capacity. Dr. James Talbot is the former Chief Medical Officer of Health for Alberta. He has been very critical of the Kenney government, how it's handled this. He says more measures are needed to get the situation under control.
Vaccine passports have had a significant effect, even though they're voluntary, in terms of increasing people's desire to get immunized. It's up about 3 times what it was before them. They need to be made mandatory. It's absolutely clear that mandates by employers, which is happening voluntarily in the province as one courageous employer after another decides they want to protect their staff and protect their clients, are also working. The minister could mandate that for Alberta government employees, for associated agencies tomorrow, and could either highly recommend or require it of other employers in the province. Those 2 things would greatly increase the protection in the province. And then the third thing is that they may have to look at restrictions as well, because with as much virus as circulating in the community right now, everybody's at risk. And it's going to take a while for those vaccines to kick in.
All right, and a reminder, the federal government is stepping in. We're hearing from Public Safety Minister Bill Blair, who is saying that, yes, medical staff with the Canadian Armed Forces are available to deploy to help Alberta. We mentioned the Red Cross as well. Let's bring in emergency room physician Dr. Joe Vipod. Dr. Vipod, thanks for taking the time to come on the program today. And your thoughts on this help from Ottawa?
Yeah, well, we need everything, because our provincial government has done such a poor job. We really need the federal government and the municipal governments to step in and fill some of that gaps. We saw that yesterday in the city of Calgary, that enacted some new policy to fill some of the gaping holes in our mask mandate policy here at the province. And this relief from the feds will also be incredibly welcome.
Dr. Vipod, you are in Calgary. You're on the front line. For people watching across the country, what do they need to know about the situation you're seeing right now?
Rising hospitalizations, rising ICU numbers. We hit records of both of those yesterday. We know that we've had cancellations of surgeries. We've had, a lot of our staff moved into other, positions, trying to work in the ICUs rather than their regular jobs. And so it's really a system in crisis. It's crumbling. And the sad reality is all of this is predictable. It's, that classic line where people say, your disorganization is not my emergency. Well, guess what? Now Alberta's disorganization is everybody's emergency.
You've got a new health minister coming in, of course. Will that make any difference, do you think?
I kind of feel like it's, those moments where you're getting tortured by somebody pulling off your fingernails and they go, I'm going to give you a break. I'm going to switch to pulling off your toenails. We're not going to be able to fix this problem with the same thinking that got us there. And so really, what we've done is we've taken the puppet, we've switched it out for another puppet, and then the puppet masters still are in their positions. We really need Dr. Hinshaw and Dr. Kenney to resign.
So you
Premier Kenney.
Yes, you want the Premier to go. You want the top doctor in the province, Dina Hinshaw, to go as well. What more could be done, do you think, in the here and now to help mitigate this crisis?
Well, Dr. Talbot did a great job at the top, saying some of the things that need to happen. I think the sad reality is we're in such a bad state now that schools need to close to in-person learning as well. We can take a break. We can use that period of time, 2-3 weeks, to really airborne transmission proof these schools by ensuring we have good filtration systems, ensuring we have good ventilation in those places, ensuring that we have excellent mask policies, which we do not at the moment. Kids are still allowed to take their masks off in their rooms when they're sitting in there for 8 hours at a time at a desk. It's really at this point preset for encouraging transmission, and we need to take that break, get the COVID out of the system, and then COVID-proof those schools.
The vaccine passport system, they're not calling it that, of course, but as you know, some kind of certificate system to try and help stamp down on the spread of COVID-19 in different parts of the province. How much of a difference do you think that's going to make?
Well, I think it's already made a difference to vaccine uptake, so that's great. We're hearing that well, some of the big problems are it takes a while for this to have an effect, right? Like our system's in crisis now, and so a policy that's enacted today that's not really going to have any impact on the system for 6 weeks isn't really a super. I mean, it's an important policy for 6 weeks from now, but when your house is on fire, installing the sprinkling system at the exact same time where you should be getting the fire trucks out is probably not the best thing. So great that it's happening. It's unfortunate that it's got so many exemptions in there and some holes in there. And we need other measures aside from encouraging vaccination in order to deal with the fire that's ongoing.
Dr. Vipod, I appreciate you taking the time. I know it's busy, but it's great to get you on the program and share your thoughts with our viewers across the country today.
Thanks so much for caring about our province. I don't even know what to say anymore.